Hey guys, this is Dr. Hub. Today we'll look at the derivatives. So derivatives of the brachial apparatus. Branchial apparatus. So to start off with, the first mandibular nerve, the first mandibular arch. The first arch, the nerve which is accompanying will be the trigeminal. So trigeminal. So under trigeminal, it is nothing but the fifth. This will include the presence of the maxillary and the mandibular divisions. So maxillary as well as the presence of the mandibular divisions. Now what will be the skeletal derivatives? The skeletal derivatives, it will include the incus. There will also be the malleus. There is the anterior ligament, and this will be the anterior ligament of the malleus, and as well as the SS. SS stands for the spine of the sphenoid. Next is the sphenomandibular ligament. Sphenomandibular ligament. Next, let's look at the pouch derivatives of the first mandibular arch. The pouch derivatives, it includes the presence of the auditory tube or the middle auditory ear cavity. So there's presence of auditory tube. There is also the presence of the middle ear cavity. So there is auditory tube as well as the middle ear cavity. So what is the MD? There is a muscle derivatives. Muscle derivatives, it includes the tensor tympani. So there is presence of the tensor tympani. There is also the muscle of mastication. We are writing it as MM. Then the mylohyoid. Let's write it as mastication. Muscle of mastication. Then the muscle of hyoid. Mylohyoid, then the anterior belly, this is of the digastric. So anterior belly of the digastric as well as a TVP. TVP is a tensor villi palatini. Next, let's look at the arterial supply. The arterial supply will be the maxillary artery. So it is the maxillary artery. Next, we look at the derivatives of the brachial apparatus. That is the second one. The second, that is a hyoid arch. So what is the nerve here? The nerve which is accompanying will be the nerve accompanying is the facial nerve. Facial nerve, we know it is the 7. So what will be the skeletal derivatives? The skeletal derivatives here will be the stapes. Skeletal derivatives will be the stapes. There is also the styloid process. So there is presence of stapes, there is a styloid process. Styloid process is nothing but the temporal. Next, there is also presence of the lesser cornu and the upper hyoid. This will be the lesser cornu. So there is a lesser cornu as well as the upper hyoid. There is upper hyoid. Next, what it includes is the styloid hyoid. There is a stylohyoid ligament. So there is a lesser cornu and the upper hyoid. There is also a stylohyoid ligament. Next, let's look at the pouch derivatives. PD stands for the pouch derivatives. So what does the pouch derivatives include? It includes the palatine. So there is presence of the palatine tonsil as well as presence of the tonsillar fossa. So there is palatine tonsil as well as presence of the tonsillar fossa. Next, looking at the muscle derivatives, MD muscle derivatives, it includes the stapedius. So there is presence of the stapedius, there is also the stylohyoid and the facial muscles. All this is part of the second arch. So stapedius, stylohyoid, there is a facial muscles. And what are the facial muscles include? It includes the buccinator. So there is presence of buccinator, there is presence of the platysma as well as the posterior belly of the digastric. So what is the artery supply of the second arch? The artery supply will be by the stapedial artery. Stapedial artery as well as the hyoid artery. So it will be the stapedial artery as well as presence of the hyoid artery. Next, let's look at the third one. The third arch, it includes the nerve, that is a glossopharyngeal nerve. So glossopharyngeal nerve is nothing but the 9th one. So what are the skeletal derivatives of the glossopharyngeal nerve? The skeletal derivatives of the glossopharyngeal nerve, this includes the greater cornu of hyoid. So it includes a greater cornu and this is of the hyoid. So greater cornu of the hyoid as well as the lower part of the hyoid. So the greater cornea of hyoid as well as the lower part of the hyoid. Next, let's look at the pouch derivatives. The pouch derivatives, it includes the inferior parathyroid thymus. It includes the inferior parathyroids as well as the thymus. Now what about the muscle derivatives? The muscle derivatives, it includes the presence of the stylopharyngeus. So there is stylopharyngeus. And what about the artery? The artery it includes the common carotid as well as the proximal internal carotid artery, that is a PICA. So common carotid as well as a proximal internal carotid artery. Now let's look at the fourth arch. The fourth arch, the nerve will be the superior laryngeal nerve. So it is the 10th of vagus, superior laryngeal nerve of vagus, that is the 10th one. And what are the skeletal derivatives? Skeletal derivatives, it includes the thyroid cartilage. So there is a thyroid cartilage as well as the corniculate. There is a corniculate cartilage, and there is also presence of the cuneiform cartilage. So there is a thyroid cartilage, corniculate cartilage, and the cuneiform cartilage. Now let's highlight on the pouch derivatives. The pouch derivative is that it includes, there is a superior parathyroids, there is presence of the superior parathyroids, and there is also parafollicular C cells. So there is a superior thyroid, there is a parafollicular C cells of the thyroid, and this is nothing but from the ultimo-branchial body, from the ultimo-branchial body. So what will be the muscle derivatives here? So all this is with respect to the fourth arch. So the muscle derivatives, if you see, it is going to be the pharyngeal muscles. So it will be the pharyngeal muscles, and there is also presence of the larynx. So larynx means it includes a cricothyroid. There will be a cricothyroid, and there is also levator villi palatini. So there is a levator villi palatini. There is a pharyngeal muscles, laryngeal cricothyroid, larynx as cricothyroid, as well as a levator villi palatini. So this is all the muscle derivatives of the fourth arch. Next we look at the artery. So under artery, there is a right side and the left side. So right side, what does it include? It includes the right subclavian artery. So there is a right subclavian artery. So there is a right subclavian artery, and this is nothing but the proximal portion. There is a proximal portion. So then comes, there is a left part, left side. So what happens in the left side? So in the left side, there is a arch of aorta. There is arch of the aorta, and this is from the left common carotid to the left subclavian arteries. So the left common carotid to the left subclavian arteries. So left common carotid to the left subclavian arteries. Next, lastly, we are going to look at the sixth arch. The sixth arch is nothing but what is a nerve? The nerve here will be the recurrent laryngeal of vagus. Recurrent laryngeal nerve of the vagus, that is the 10. Now what are the skeletal derivatives of the number 6? Skeletal derivatives will be the arytenoid cartilage. And what will be the pouch derivatives? The pouch derivatives will be nothing but the pouch derivative is nothing significant. Next we look at the muscle derivatives. The muscle derivatives, under this there are all intrinsic muscles. So what do you mean by all intrinsic muscles? So these are all intrinsic muscles of the larynx. So is there an exception to this? Yes, there is an exception. That is the cricothyroid muscle. The cricothyroid muscle will be the exception. The cricothyroid muscle. This is the exception. Next we look at the arteries. So what is special about the arteries of the sixth arch? The arteries is divided into right and the left. The right side is going to be the right pulmonary artery. And next we have the left. So left will include the pulmonary artery and the ductus arteriosus. So it is the pulmonary artery and the ductus arteriosus.